for healthcare knows it can be confusing, so here to share some useful tips is Dr. Emily Transu from the Washington State Healthcare Authority. Welcome. How are you doing? So, what is the first thing we need to decide about? Is it our health insurance, our plan?
There are a lot of different pieces that you need to decide, and certainly, during open enrollment, thinking about what plan you're getting, who's your doctor, are they covered by that? That's always a good starting point.
And so, with all the changes that are potentially going on, are you finding people having trouble making decisions about just where to go, not only to buy a plan, but which doctor to see? How do I make sure I'm seeing somebody I can see the same time next year, etc.?
Absolutely. There's so much uncertainty right now in healthcare, and I think people are more conscious of the importance of making decisions, but haven't necessarily figured out how to do that yet.
So where do we start?
Well, I always think about it the way you would think about any other big decision in your life. If you were buying a car, you would go out and do a lot of research first. You would really think about what you need and what would be a good fit for you. You would find out what's out there, and you would ask a lot of questions before you make a decision.
So what kinds of things? If I'm trying to figure out what I need, what do I need to ask myself?
I think of it in a couple big categories. One is quality. How good is the care that you're getting? And another is cost. Are you really getting good value for your healthcare dollar? Are you paying a fair price? And then the third is patient experience. What's it like for you to see your doctor? Do you feel respected? Do you feel cared about? Are you able to ask the questions you need to ask?
Well, 1 and 3 make good sense to me. The value question, I think, is how do we know? It's hard to know what we've paid for what and how to know if that's more or less than if you went somewhere else.
Yeah, and not that many years ago we wouldn't be talking about this because people didn't really think of healthcare as having a cost exactly, but we all have a lot more skin in the game than we used to. And things can cost very different amounts at different places, and more isn't always better in healthcare. Sometimes the most aggressive option is also going to be riskier. So you can get information about how much things cost. There's a terrific website that the Washington Healthcare Alliance has created in conjunction with the state of Washington to put that kind of information out there about costs as well as about quality.
So you can go there and kind of get a cost analysis and comparison.
Exactly.
So how do you make sure you're getting quality health care? Most of us go to the doctor and just trust whatever it is that he or she says. How do you make an informed decision about whether you've gotten the appropriate care?
Yeah, it's tough to talk about because all of us as doctors are really trying to do the right thing.
Of course, yeah.
And but we're all improving, and we all have room to improve, and some are better than others. We didn't used to have that information, but now there are really great quality metrics that have to do with, if you have diabetes, who's giving good diabetes care, who's giving good preventative care. So that information is available now.
Where do we find it?
The Health Alliance has a website, again in conjunction with Healthier Washington, called Own Your Health, and it's got terrific information out there about cost, about value and quality, about patient experience, and also good information about the kinds of questions you should be asking.
Good, because I think we need more and more of this information. You mentioned Healthier Washington. What is that?
Healthier Washington is a major initiative by the State of Washington Healthcare Authority to really transform the way healthcare is delivered and received here in Washington State. It's founded by a big federal grant, and it really looks at improving the health of the whole population, improving costs, and improving people's experience of getting healthcare.
So if you think you are seeing a doctor that you really, really like, and you'd like to continue to see that doctor, how do you make sure you can do that? I mean, what would be my research path to make sure I could do that?
A lot of that has to do with the health plan that you're getting, because they'll be contracted with specific providers. And that's a really important question to ask.
That might be the most important one for a lot of us,
It might well be the most important one, yeah. And every insurer has information on their website, or you can call and find out and just ask that question. This is my doctor, and I want to make sure I can continue to see them.
And we shouldn't be afraid to call. There have been times in the past where it seems like, okay, that's too complicated, but everything's kind of set up for you to be able to ask questions these days.
I think asking questions is the most important thing you can do in relation to your healthcare. So yes, always reach out, look for information, call if you can't find it.
All right, let's talk about healthcare spending. A lot of us have reached that age where there's a lot of screening tests. There are various things you're supposed to do. What should I be aware of as a patient about what I'm spending?
The first is that more isn't always better. So you should always be thinking about, do I really need this? Always ask the question, what are my other options? Do I need it now? So first off, ask that. Second is the person that you're seeing covered by your insurance? Are you making sure that you're not going to be paying extra out-of-pocket costs because of where you get care? And then another is really to think about where you're getting it. You know, the emergency room is a fantastic place if you're really having an emergency.
Right.
But if it's a problem that your primary care doctor could take care of, that's going to be a lot cheaper and probably a better experience as well.
So sometimes just waiting till in the morning or till you can make an appointment, if that's feasible,
If that's
would be
feasible,
a good decision.
yeah, call the nurse advice line and find out if you're not sure what to do.
I love the nurse advice line.
aren't they the best?
Yes, the absolute best. So where should people go if they want to learn more?
So the website called Own Your Health has fantastic information about quality, about costs, about experience, and lots of good resources for how to think about these kinds of questions and what to ask.
Very good. That's a great resource for people. Thank you so much.
Thank you. It's been a pleasure.
Appreciate it. To learn more about the Washington Health Alliance or to get help finding the right health coverage for yourself, please visit the website on your screen, Own Your Health WA, W-A, that's WA, right? .org. Up next, a fun preview of this year's Pacific Northwest Scottish Highland Games. We'll be right back.